and she never got well.
The medication they had to go through was pretty tough.
I was just put in a small cubby hole and just told to stay there.
The origins of Mycobacterium tuberculosis, or TB as we know it, have plagued some of the earliest civilizations. DNA findings in ancient Egyptian remains has provided us with evidence that TB is well over 4,000 years old. The incredible resiliency and slow replication of these bacteria has made TB one of the most difficult bacteria to eradicate in the history of infectious diseases. By the 17th century, 1 in 4 people died of TB in Europe. There were many names given to this disease that killed so many. To some, it was the White Plague. To others, consumption, because it consumed and left people weak and emaciated. There was no cure for this dreaded disease, and no understanding about how people developed TB.
There was a lack of scientific evidence at the time on how TB was actually transmitted. Therefore, much of the history you'll find misinformation and sometimes really inappropriate measures on preventing the spread of TB.
You would have visitors and you would know they had TB?
Yeah, well, Mom knows, yeah.
You just used different dishes for them?
Yeah, and tied a string around it and put it somewhere where they can reach.
Anything they touched, they had to burn or throw away, and all my dishes were like sterilized or kept in my room.
The older ladies at that time would get together and they would be boiling the sheets and everything, trying to kill the germs.
And books that I read or whatever, they had to burn.
TB was thought to have been introduced into First Nation populations approximately 300 years ago through early contact and explorations made by Europeans. It is hypothesized that this TB epidemic came to eastern Canada first, almost 100 years before the west coast of Canada. With the advancement of the railway and Canada's growing population, TB infection soon invaded the prairie provinces.
Elders have shared some stories about how traditional plant medicines have cured cases of TB in the past. And depending on the disease variables and the human immune system at the time, that very well may have been true.
Other elders are not so sure. One thing is certain, however, it could not stop the massive spread of tuberculosis among First Nations communities. In Canada, TB was the leading recorded cause of illness and death between 1877 and 1927. The first breakthrough in understanding the nature of this disease was the discovery of the infectious tuberculosis bacteria by German scientist Robert Koch in 1882. The discovery of the Mycobacterium that causes tuberculosis and the proof that it was an infectious disease soon led to massive medical TB campaigns and advertisements on how to protect oneself. Unfortunately, it also created stigma and fear about TB, and those who suffered with TB were sometimes treated as outcasts.
I remember growing up, hearing the stories and hearing how, it was a grave concern to everybody.
The individual families treated them all right, but the community, some of them were kind of worried and scared and kind of stayed away.
There are still some remnants of fear and shame when we talk about TB in communities. So today we really try to dispel those myths and educate community.
Being a people person and loving the kids, and the elders when they come in, I was afraid that I was going to have to stay away from them, and I didn't want that.
Technology has come a long ways and health has come a long ways.
When my mom had TB, I thought that she would end up in hospital forever, but she didn't. She got to go home.
The first organized efforts to control TB began with the era of sanatoriums in Europe. Isolation, rest, fresh air, and good nutrition were used to nurse people back to health. Improvements were often slow, depending on the individual and how far advanced the disease was. In the first 25 years of the sanatorium era, 45% of patients with TB died. The first sanatorium opened in Canada in 1897 and appealed to people who could afford the treatment and travel expenses. Shortly thereafter, the federal government was lobbied to provide free treatment for those with TB in each province. Very few, if any, First Nation peoples were afforded such treatments during that time. By 1938, Canada had 61 sanatoriums, and by 1953, there were 101 sanatoriums with a total of 19,000 TB beds provided across the country. While sanatoriums were being erected across Canada and supported by each province, there was little being done about the epidemics of TB sweeping through most First Nation reserves.
There were many people left to fend for themselves in First Nation communities. You will still hear today stories from elders about their families and relatives who died of TB.
First Nation healthcare services were considered a federal responsibility. Therefore, research and prevention of the TB problem was insignificant until it was brought to the attention of the federal government by a few concerned physicians. By the 1930s, it was reported that TB mortality rates for First Nation people were in excess of 700 per 100,000 on reserves, and for residential schools, mortality rates reached an astounding 8,000 per 100,000 population. With non-existent or inconsistent TB pre-screening policies for these schools, many children became infected and died of TB, either at the school or shortly after they left. The first TB school survey in Canada was conducted in 1921 in the province of Saskatchewan. Results from a sample size of 162 First Nation children screened showed that 93% were infected with TB.
We went to Cranbrook School. They took me out of the dorm with the other girls, put me into isolation, and they told me I had TB, and that was why.
The first TB research undertaken with First Nation populations occurred in Capel, Saskatchewan from 1933 to 1943. The results of these early findings helped pave the way to routine use of BCG vaccine.
This vaccine helped to protect First Nation children from serious forms of TB, such as miliary TB and TB meningitis. We have used BCG for decades, but we've just since discontinued it in 2003.
Although it was successful in contributing to the declining rates of TB infection in children, it was proven to cause serious complications and potential fatalities in children with underlying immunosuppressed conditions. The first BCG study was also an impetus for the creation of sanatoriums specifically for First Nation people in need of treatment.
When I was a young girl in the Kamloops Indian School, my sister got TB, and she was taken away from the school and put in the Coquilita Hospital in Chilliwack for about 4 years. So she must have been about 7, I must have been about 6.
Prior to Coquilita, a sanatorium was built in Kamloops called Tranquille. Although it was centrally located in British Columbia, the majority of patients admitted there were not First Nation.
Travel to Coquilita was challenging for those who lived far away.
We received the news that I had to go down to Coquilita through a letter. That's when my dad had borrowed my grandpa's car, and we'd driven down. And I believe we went down the Hope Princeton Highway, and I remember the road being long and windy, and I'd play in the back of the car and I'd sleep, and we'd stop, I think, in Princeton for lunch. And then later that day, we'd end up down in Coquilita. The nurse wanted to take me, and I was only 5, so I wasn't told anything. I kind of looked back at my mom and my dad, and my dad just kind of nodded and said, "It's okay, go."
Once people were there, It was often the last time they saw their families until they were released.
I stayed there from 1949 to 1954.
It's a long time.
Yeah. I wasn't the longest there. There was one girl who was there 13 years already.
I remember well that there was a lady that was a neighbor. She was in a hospital forever. She never came back.
One was sent to a sanatorium for 10 years.
But it was better than Cranbrook because they weren't allowed to spank you or nothing.
I had no idea why I was there really or how long I was going to be there. I recall sitting on a ledge there looking out at the window, and it was raining, and I remember crying. We were taken outside for fresh air, and I remember walking along a fence looking up at the big mountains down there. How long was I going to be here? Were they ever going to come and get me?
Sanatoriums in Canada offered the same treatments as Europe, such as rest, nutrition, and fresh air. Surgical interventions such as lung collapse therapy or, in rare cases, removal of a lung lobe were often feared. Many people have painful memories of such invasive procedures.
They do all kinds of stuff to you. I'm supposed to have complete bed rest. You can't even lower your feet off the bed.
And how long was that for?
The first time was for 4 years.
Despite experimental treatments and 24-hour bed rest, social activities helped to make the stay at Kokolitsa Sanatorium a little easier. Entertainers played musical instruments, patients shared conversation with others from their own communities, some made new friends, formed new relationships, and even married. Children continued their education in makeshift classrooms or from their bedside. Although the longing to return home remained ever in their hearts, for many returning home proved more difficult than imagined.
Many had to renew relationships and get to know their family again. So it's understandable how people did suffer mentally and emotionally.
Because after that, when my mom died, my grandmother took me and raised me.
I found out I had 2 little brothers that I never knew I had.
With the arrival of antibiotic medicines capable of curing TB, tuberculosis cases started to decline. Many sanatoriums proceeded to close their doors. Today, the treatment and care of people with TB is done at home or in community.
I had a positive test, and so I had to take medication for months.
I did it. I took the pills every day like I'm supposed to, and I never missed a day.
In advanced cases or problematic circumstances, tuberculosis care continues to be provided at Vancouver General Hospital's TB ward. We currently treat TB with the same medications discovered in the 1950s and 60s. TB strains have evolved to become resistant to certain medications. These drug-resistant strains are a concern for the future control of TB. TB continues to be seen in most First Nation communities. Rates continue to be unacceptably higher than the general population. Although TB is now treatable and can be cured,
it's easy to see why TB continues to be a problem in First Nation communities today. The difficult part lies in addressing those underlying causes of TB.
Crowded housing, poverty, limited access to healthcare services in remote communities, poor nutrition, and other factors all contribute to the ongoing transmission of TB. Screening for and treating tuberculosis today greatly reduces the number of cases each year in First Nation communities. However, we must continue to address and act to improve social conditions, many of which are the root causes of TB. Education with community also plays an important role in alleviating stigma, misinformation, and misconceptions about TB. Together, we can work towards a future free of tuberculosis.
I want to be healthy for my grandchild.